So, we've got a clinical case. Great. Okay, let's be careful. Give me clinical case. A 68-year-old man with a history of stable angina presents to the emergency department with severe crushing chest pain. His blood pressure is 105, 70 mercury, and his heart rate is 90 beats per minute. So blood pressure 105, 70 mercury, and his heart rate is 90. You suspected an acute coronary syndrome, definitely. As per protocol, you plan to administer sublingual nitroglycerin. Before giving the nitroglycerin, which of the following questions is absolutely mandatory to ask the patients to prevent life-threatening complication? Options. Have you taken any aspirin in the last 24 hours? No. There's no problem with this question. Have you recently taken any medication for erectile dysfunction like sildenafil, Viagra? Of course, that's a good question. Are you allergic to morphine? Have you had any recent changes to your blood pressure medication? No, I suppose correct one is have you recently taken any medication for erectile dysfunction? No, like sildenafil, Viagra. Yes, this is the correct option, my beloveds. This question tests the knowledge of the single most dangerous and absolutely contraindicated drug interaction with nitrates. So, have you recently taken any medication for erectile dysfunction? Is it like a sildenafil? It's a correct one. It's a correct option, yeah. Okay, let's explain. So, mechanism of nitrates. Nitroglycerin works by donating nitric oxide, NO, which leads to production of cyclic GMP. Cyclic GMP is a powerful vasodilator, causing veins and arteries to relax, which reduces the workload on the heart and relieves angina. So, mechanism of sildenafil, Viagra, is a phosphodiesterase 5 inhibitor. So, its job, to prevent the breakdown of cyclic GMP, thereby enhancing its vasodilatory effect to facilitate an erection. So we've got a deadly interaction. When a patient takes both drugs, their mechanisms become synergistic. Nitroglycerin massively increases the production of cyclic GMP, while sildenafil completely blocks its breakdown. So this leads to a profound and unstoppable accumulation of cyclic GMP, causing catastrophic refractory vasodilation. The patient's blood pressure can plummet to dangerously low levels, leading to severe hypertension, shock, and potentially death. This is an absolute contraindication. The standard rule is to avoid nitrates for at least 24 hours after sildenafil use. Why other options are incorrect? Give me options. Any aspirin in the last 24 hours. What's the problem with this question? Aspirin is a cornerstone of acute coronary syndrome treatment. Taking it beforehand is actually beneficial and not a contraindication to nitrates at all. What else? Are you allergic to morphine? Morphine is often used to pain control, painkillers. Morphine, of course, is often used for pain control in this setting, acute coronary syndrome. So knowing about an allergy is important, but is not the most critical one. Life-threatening contraindication related to giving nitroglycerin. Any recent changes to your blood pressure medication? This is a good general question, but it doesn't address the specific acute and catastrophic interaction that the combination of sildenafil and nitroglycerin can cause. So, high-yield takeaway, my beloveds, before administering nitrates to any patient with chest pain, you must ask about recent use of sildenafil, tadalafil, vardenafil, PDE5 inhibitors. This is one of the most critical safety questions in emergency medicine. Stay blessed.